we pack our bags and go. But the Physician Assistants Association of Ghana says it's vehemently opposed to the proposed Health Professions and Regulatory Bodies Amendment Bill currently pending in Parliament. The rejected bill, according to what the anchors gathered, is being spearheaded by the Medical and Dental Council through the Ministry of Health, ostensibly to render the physician assistants useless on their job. The association insists the bill only seeks to reduce their work to nothing because it imposes medical doctors on us, frustrates efforts to grow and develop our profession. At an emotionally charged press conference yesterday, that is the Wednesday, the 19th of July 2023, led by the President Peter Kudugu Ayamba and the General Secretary Peter Eiram Kwenyefu, two Peters there. The association said, aside from the bill not being in their interest, the Medical and Dental Council did not involve them in drafting it, as they were totally sidelined in all of what happened. The GPAA is therefore calling for, all the stakeholders. They are all calling on the stakeholders to come to the table and have a conversation. Well, let's connect now with the Peter Sari. Peter Ayamba. Peter, good morning. Thank you for joining us.
No, this is not Peter Ayamba.
This is Peter.
This is Anthony Akpo.
Anthony Akakpo?
Yes.
Okay.
This is Anthony Akpo. I am the president of the Graduate PA Association.
Say again. Janet is mentioning another name to me. You also mentioned what's your name, sir?
This is not Ayamba. Okay. Ayamba is the leader for the Ghana PA Association. I am the leader for the Graduate PA Association.
Okay, so there are three or so of your groupings. Is that
only two? Only two associations.
Okay,
and we collaborate. Yeah.
And you are?
I am Anthony Akon, the president for the Graduate PA Association of Ghana.
What's the difference between you and the other group?
We are one. The only thing is that it's just like the problems that emanated the NAGRAT. That's what emanated us. And so at every single level, we collaborate to practice. We've been collaborating since our emergence. Yeah, that is it. And sometimes some things bother the graduate group from the university. They came directly from the universities, all the universities in Ghana. And then the other having to have started from the College of Health earlier on. So that's the only difference with us.
Now, you say you are not happy about a certain health bill which you have tagged retrogressive. Have you seen the bill? Have you read through the bill?
Thank you very much for this opportunity. In fact, in 2018, I was with the group that actually worked to stop or cease the progression of the bill because it didn't consider stakeholder input. When I say stakeholder input, our input as professional bodies or professional associations. And so I have a copy since 2018 and 19 when it was actually presented by the former registrar. And then the current one too, nothing has changed from the previous one. So I have the bill. In fact, I'm the one that made it available to the other professional groups and then leaders as well.
Now, what exactly is problematic with the bill that you have seen and read and distributed accordingly?
Okay, in 2019, when we saw the bill, myself and my leadership, we put in what we call some input, a memoranda. I mean, at a certain point, that is what should be needed. And so I think 2020, when this new registrar actually came, he also started the whole process because he has a law background, so he knows what parliamentary procedures and all that. So the chief of staff actually called for input, and I submitted. And I went on section 43 and 50 with our legal team, and then the head of legal of Ministry of Health actually called myself that we should submit input from section 27 to 50. And this is what is in the bill. The bill, which is to be presented by the sector minister, the sector minister is mandated to present amendment of such issues. It's actually related to part 2 of the Health Professions Regulatory Bodies Act,
right?
2013 at 857. Now, the part 2 of that act mandates, establishes the Medical and Dental Council, and then mandates the Medical and Dental Council to regulate the practice of medicine and dentistry in the country. And under the Medical and Dental Council, there are 4 professions. Now, you have medical officers, dentists, we have physician assistants, which I will refer in our discussion as PAs, and then we have certified registered anesthetists, hereinafter a CRS. Now, what happens is that the regulation, the council is mandated with 3 core directives or tasks. 1, to regulate the training. 2, to regulate the practice. 4, any other thing that is necessary for the development of these professions. Now, if you take the first 2 professionals, the medical officers and then dentists, which were already with the council, I think under an NLCD decree. So we were actually added by ministerial directives in 2010 that looking at our practice, having been in the country since 1923 under the name dresses, work with colonial the doctors who were then around. Later, our names have changed to medical assistants, and then the physician assistant program in itself was introduced into the country somewhere early 2000.
Right.
So the council was to regulate our practice and training and the development. But since we joined 2010, there has never been a single policy that will move to ensure the development of these 2 professions, the PAs and the certified registered anesthetists. Now, this is it. Let me give one policy.
Okay.
Before 2005, there was a housemanship policy. The policy was developed by the Medical and Dental Council. Before then, when you finish medical school, you are to do housemanship for 1 year. But they saw that the medical officers or the after house job for 1 year, they were not so much equipped with skills to independently practice and to understand things within the sub-district. So they added they brought a new policy that made doctors undergo 2-year housemanship instead of 1 year to benefit them. As part of the policy, they are to be provided accommodation, and then the salary scales were also there. They were to be provided with allowances. It is in the policy made by the council. Now, the same thing when it comes to physician assistants, we have moved and written letters during the former registrar-led administration time and then the current one. Okay. In fact, I was part of it. And even we were the first to have led some of these things that, okay, intense, what is happening to the internship policy? Why don't you develop same for these people? At least for giving them accommodation, giving them all these provisions, because when you are undergoing internship, it goes beyond the normal service. They never did it. So as I'm talking to you now, they complete the 4-year medical training as PAs, undergo 1 year internship with no money, nothing, with no remuneration. They run night duties, they on-call duties, and other things. So this is the first neglect that they have, because we were not part of the council. There's that discrimination on policies that can even move and develop. The other thing is that the council, we can look at the next council, the pharmacy council, having teamed with the Ministry of Health to even establish, develop, what do we call it, entry qualifications when it comes to PharmD, BFARM. The pharmacists were training in Bachelor of Pharmacy.
Right.
Now the council says that the registrable qualification should be PharmD. So they have developed academically. They are not those. The council doesn't build schools, but the council can move a policy to say that at this level, this is where we want the training. So after training at the bachelor's level, we say say that, okay, around the world, there are masters and postgraduate programs, and the council has kicked against it. They are not training PEs in master's degrees. Okay. They are not training PEs. When it comes to specialty establishment, I understand there is an act that establishes specialty training, the Plant Medicine and Specialist Training Institutions Act, which was amended, but it doesn't provide for us. But if you have come under the council, there could be a policy that can move. Okay, you are not doing anything. That is okay. But then you amend an act or an act that seeks to undermine and take away our autonomy, the sovereignty to practice medicine. Section 43 of Section 43 of the Act.
Explain how that does that. Explain.
Hello?
Explain how that does that.
Very good. Section 43 of the Act states, talks about the right to practice. That is where the right conferred on the practitioner to practice medicine is. Now, if you take the A and then the B, section 43, A to D, and then the second part of it, the subsection 1, A to D, subsection 2, the whole of subsection 2, they have taken our power. They are saying that if you are trained as a PA in medicine at any level, even if later you may do a PhD in medicine, you may have your postgraduate master's degrees in medicine, no matter where you apply, before you can practice medicine, you have to seek what do we call it? A direction. I say, why? They took away all those powers to work within our job description that before you can practice, you must call somebody, maybe sitting somewhere in Accra, call a supervising physician to say that, okay, Auntie Mansa came to the consulting room with, and he can't breathe. I'm seeing these conditions, maybe acute life-threatening condition, like, let me say simply, asthma. So the patient comes and he said that you can't, I have to pick my phone. Who is paying for the credit? I have to call somebody somewhere. Hello, supervisor, please, a patient. By the time I'm done, the patient said. They are saying that when you have cases like when a patient comes and is pregnant, which we have been managing since 1923, and more officially since 1950, immediately the patient is pregnant, I should refer to the midwife. And you see, the funny thing is this. We have about 1,004 health centers in Ghana. And all these health centers are the drivers of what we call primary health care services. Primary health care is not just a lower health care, but primary health care is making health care affordable, accessible. So if somebody has hypertension, somebody has diabetes, or any other disease, you do not wait for this condition to escalate or become complicated. So you have health practitioners at this level who mitigate
Peter,
before it becomes complicated.
Peter, if I hear you well, you're suggesting that this bill will suppress you and it actually looks down on your profession. Is that the sense of what I get?
Not just suppress or insult. It takes away our power authority to practice medicine.
Have you had any conference regarding your grievances or your concerns about this bill?
Let me come. You can find some of our listeners with the Graduate Physician Assistant Association of Ghana. We've done a lot. In 2019, before we entered the election, there was a scope of practice that is spelling out what I'm telling you now. Now, the scope of practice is a policy. And when they were drafting the scope of practice, they didn't consider medical officers. They didn't do for them. They didn't do for dentists. They did only for PAs and then CRS. And you know, the scope of practice is saying the same thing. And we organized, we wrote letter. I have a policy, our input, our position paper to the minister. I wrote a position paper to the Ghana Health Service Council. And we happen to have met the minister directed, we meet the head of medical and dental at the ministry. It's called Dr. Bafubwa. We met him. We copied this same scope to the Medical and Dental Council for them to look at it because the act was delaying. The act has to pass through procedures. So they brought the scope, and you are premising the scope on an act that has not been passed, a bill that has not even been presented. And so we saw it's illegal, and we're going to court to And we have even spoken to the Director General, this one, Professor Dr. Kumabwa Abwadi. I told him in some recent meeting that this scope of practice even acknowledged you. He denied. He said that he didn't know about the scope and that we were in this country when midwives who did not have the capacity to undertake medical abortions were empowered, so we should disregard the scope. But do you know the scope is being purported and propagated around to other professional groups that they do not have the power to practice medicine. So we have written letters.
I see.
There is a letter that has been written even to the minister.
Okay.
But let me say this.
Quickly.
The minister has done enough and a lot for us. I have to tell you.
How do you mean when you say
when
has
I
done
say
enough?
a lot, listen. Since 2018, our people have not been posted. They post nurses, they post midwives, they post allied laboratory and all workers, they post medical officers over and over and over. So we wrote a letter. I even petitioned the Council of Elders of this government through the General Secretary. One of us presented it to the General Secretary himself and copied the Minister for Labor and all the stakeholders. And they got it. The minister told us that anytime he put in even financial clearance, it gets to cabinet. And they said that they don't need peace. I said, you are kidding me. We are growing. The 111 district and then the agenda, whatever they are bringing, it doesn't benefit us. These are the people to be used. We are supervising 5,421 chiefs compound headed by a midwife and nurse. And we have the community level too, which is the gateway into our health system. So if you want to reduce long waiting hours, you want to reduce clinical load, you want to create more access to health care, how can you put barriers? Even nursing, let me say this, I don't say this to disrespect, even nursing assistants, do they have that discrimination within them? Have you ever seen that a nursing assistant in the job description says that he has to call a nurse to be supervised? But at every level, there is supervision. We have our chief PAs, deputy chief PAs, principal chief PAs. Some of them have about 30 years. And you are classifying in a law that will go against us that we should work. Even driver's mate don't they graduate. What is this?
So I know that the way Parliament works, when a bill is introduced, they go and refer it to the respective committee of Parliament or select committee of Parliament. And then the committee allows for persons like you who may not agree with the drafted bill or copy of what is before Parliament for consideration to bring in a memorandum or a petition of a sort. Have you written to Parliament since this came to your attention after the Speaker read it on the floor?
Let me come. I have to say this. The bill has not been tendered into Parliament. The bill has not been read on the floor of Parliament.
So your counterpart group, the Ghana Physician Assistants Association, they say that additionally, I'm quoting from the Anchor newspaper, additionally, the PAs explained the proposed amendment is also seeking to prevent us from signing medical forms, something which is already part of our work. They say the association became aware of the bill when the Speaker, Alban Bagbin, on June 6, recalled members of Parliament to consider some bills which included the Health Professions and Regulatory Bodies Amendment Bill 2023. According to them, all attempts to get a copy of the amendment bill proved futile. Are we talking about the same bill that's Act 857, or are we talking about a different one?
Yes. Let me talk. I've been talking to the President, Ayamba. We've been speaking a lot on collaborating on this. Let me clarify this. There were about 69 bills published by some of you media stations, including, I think, Ghana Web also, that this bill is to be tendered to Parliament. In fact, however, the minister, when we met the minister denied that he has presented this. And our intel, the issue is this. There is so much pressure on the council for the minister to present this bill. the minister has problems because we have raised consent to the minister. And the minister has considered that, no, this group of people is affecting them. Now, there's so much pressure. We came out because the minister is but one person within the health sector. And he's going through a lot. And we are the ones concerned. And so we came out to educate and register our displeasure. And the displeasure is not even for our benefit. It's for Ghanaians. This is going to collapse our healthcare system. Some people are bringing this in, okay? Meanwhile, the old ways of working will be there. Then they will use this opportunity for more incentive.
So my question still stands. Have you made an approach to Parliament in terms of a formal memorandum or a petition of a sort, so that when the committee sits to consider divergent views opposed to what is presently contained in the bill, then yours will come to the forefront and you'll be giving a fair hearing in the House of Legislature? Have you done that?
Yes, we have met some members of the Health Committee. I must state it. Even as of last year on this same bill, some also said that it had not gotten to them. We were, in fact, let me say this, most of the things that we have done, we have acted on very reliable intel. The document, if you have it, you are having it from us. We released, we gave to our sister association as well, that this is actually the document.
You cannot be too sure that we got a document from you.
Pardon?
You cannot be too sure that we got a document from you.
Oh, okay, all right. But I can give to you in case after this discussion, so that you can have a look at the document. I can give you the previous, the normal act, which is Act 857, and then the amendment bill, which is to be presented, which is not different from the 2019. So I can forward it to you so that you can have time. But we have petitioned Parliamentary Select Committee. We have done that. Okay. And then not only that, we have petitioned, even when the input was called, we submitted input to the head, the legal department of the ministry. But the input were not adopted into the final, what we call it, bill. And whenever you act, at the time our sister association were asking for the bill, they were denying. So we also have to pass through and get it, and then we share. And then when we got, it was the same 2019 content that was purported. So we have taken these steps. We have done it. The response, the minister is doing all he can so that this thing can be resolved. But there is pressure from the council to subjugate us. That is the problem.
I see. And now you say because of all these issues you have raised, you will lay down your tools if you haven't already. How long do you intend to lay down your tools?
We started a sit-down strike as a graduate group. We started a sit-down strike on 13th to 18th to address some of these things. And in fact, I am not really happy. Since 18th, we also withdrew, 19th from 19th, that was yesterday, we withdrew our services when it comes to emergency OPD, emergency services as well. When we're sitting down, we were attending to emergency, okay, and any on-call duties, we were attending to them, but we were not attending to OPD case. And we thought about OPD in Ghana here, about 70% of all OPD attendants, you find us there in most hospitals that we are actually circulated. And we don't want this thing to escalate. I have to tell you, the ministry through the PRO has responded to us and has called for a resubmission of our reliefs, and so that we can sit and discuss. And the only thing we are asking for is that we want our counsel. And this thing can be done through the Attorney General because it's an act of Parliament that established the council and gave the power. Even the first PAs who were produced from the university, the Attorney General gave that recognition before they could practice because it was a new name. The name that Ghana knew was medical assistant. But when the universities produced the physician assistant with the American model, it was the Attorney General. So we want to go through the Attorney General. Let there be a transition board so that we can have our own council. We don't have issues. You won't develop the people. You don't have to hate them. If you hate them that much, let them go. Let my people go. Let us go and have our own council. You go to the United States, they have state medical boards, And on these state medical boards, they have autonomous PA boards that regulate their own license. If there is any disciplinary measure, they meet out to them. Go to East Africa. East Africa, I happen to be the vice president for the Global Association of Clinical Officers and Physician Associates. And so, in East Africa, they have their own Clinical Officers Council. That is the name they use there. So we have in Kenya Clinical Officers Council, Zambia, they have it. And they are doing well. Even when they have HND in clinical medicine, that is the name of the course, they are able to do complex surgeries and cesarean surgery sessions and all these obstetrics emergencies. You go to Ethiopia, they are my friends because of my position at the world level. Okay? And so it's not something I have friends. In Ethiopia, they train them in Master of Science in Integrated Emergency Surgery, in obstetrics, gynecology, and then general surgery. They do all forms of surgery. And they have lifted the Ethiopian healthcare system. As we know, the economic situation in Ethiopia and co. And they are called surgical officers. You understand? Or surgeons. You call them surgeons. And they are doing well.
It looks like you have a lot of issues. But now that you have written to Parliament and Parliament has, accepted what you have written for consideration in the coming days when the conversations will happen around the table in Parliament, would you not think that a withdrawal of emergency services will be an overkill since you are still at the table discussing?
In fact, I have said I'm really uncomfortable with this situation. But, brother, since 1923, we are 100 years in Ghana, even before the establishment of the place of Ghana Medical School and started training doctors. We were here in 1923. We have only, this is the second time we have only embarked on an industrial action. It was 2018 on some conditions of service and ill treatment when one of our own was wrongly arrested. And then this time we are not even asking for money. We are not asking for conditions of service. We are only giving accepts of what will happen. That is all we are doing. The council is actually strangulating the healthcare system by subjugating it. So we want to give these are assets because they are saying don't attend to pregnant whatever. We stated in our release that when these emergencies come, refer to the medical director. They can take care of it. So let them handle it. Or the clinical coordinator who is a medical officer. And I'm saying, how many patients can a single doctor sit in the consulting room with our birth rate and the attrition of doctors? And then some are retiring. They register. You can't use even the registration or the permanent registration or annual retention register because some of them are even outside the country and they are still maintaining their register. So the number that you see on the register is not what is actually practicing here. Okay. And you can never break the gap. Even in the US, they are giving us this. So it has that this thing has to happen. But we are protecting the future of Ghanaians.
So should the people die? The future of Ghanaians means that they have to be alive to be in the future for you to know that, yes, you protected their future. Now you're going to withdraw emergency services. Should the people die because you want a portion of the law, in your favor, or you want a council or all the other reliefs you're seeking?
What will be more better to have a bill, a xenophobic act or bill that will perpetually create this situation you are asking me to answer, or to demonstrate the effect of it so that we stop it? Which one is more better? If the act is passed, when will it be amended? Because this thing we are talking about is going to happen.
You just
so
asked.
Why don't we bite our lips?
You just asked two questions to answer one question, but I need an answer from you, not two questions. Should the people die because you are seeking relief?
Unfortunately, like you have seen, if you have gone around, you will see that even it is difficult for some of us to even join the strike. They still love the people, and some of them are still working. Some of them are still working. So this is the kind of profession who do not look at prosperity for their own, on their own, but for the people. I don't know how to say that I will enjoy seeing somebody condition complicated. I'm not happy. My mother is being taken care of by a PA. I am not happy. So how I should accept it? No, but I think we've had positive feedback, so we want to go back to work. And I think the minister, parliament, they've heard our grievances. They should not take the stripes of one person, the animosity of one person towards a particular group of people to accept this bill.
Okay.
And we are praying to the minister, like he has always done. He should stand on his grounds on these days, days, so that he can actually defend the health system and this bill can be abolished. If there should be any amendment, we need part 6 or 7 of the Clinical Officers Council, period. And then they can establish whatever. So let us take this stance. Instead of removing and taking authority to practice medicine, let us insert a council for them, put in measures, because our numbers are just equal to medical officers.
Okay.
And we are enough we can manage ourselves.
Anthony
Once
Aku,
there is a proper board put in place.
Anthony Aku, I thank you very much indeed for your time. You're president of the Graduate Physician Assistants in Ghana. Thank you. Grateful. That is serious.
Sunrise. 3 FM Sunrise.
Helen, as a child of God, will you do the same for them? Because this matter there, it's a serious case. I mean, it is. I mean, they have a point. Well, the Medical and Dental Council also think that, well, we must all be under one big umbrella. They think that, well, we must be decoupled from it. They are demanding for their own council. But while they wait and withdraw services, we know that people may die or will die.
That's the tricky thing. And you asked the question, should people die? Yeah. I've been trying to wrap my head around the issues and the grievances. The dialogue is going to be very necessary, but they're remaining firm in their stance that they will withdraw their services. So I hope that government is listening. We're told we have a listening government, and they can, spring to action so we can mitigate what could possibly happen. We don't need more Ghanaians to die needlessly.
William,
I don't see why and how this has become an issue. Because if there's a bill, there's no way anybody can push a bill without consulting stakeholders. And these are identifiable stakeholders.
Right.
So I don't see how we got here.
They say they were not included.
That's the point I'm making, because you cannot push any bill.
Yeah. And need all hands on this.
Yes. Yeah. It is a given. There's no way you can push a bill to Parliament and not consult all the stakeholders. Even if the law is passed, there's an ally that comes after it to make it operational.
That's right.
That's where the nitty-gritties of how the law will operate are outlined. And this one, you need the inputs of everybody in that space, especially when they're identifiable, to make these things happen. So for us to get here to the point of striking for people to die, I think Ghana, where we are still developing. I think we are still on the ground. We haven't taken off anywhere. We shouldn't deceive ourselves, so that if things happen, we escalate it to a point where we go on strike and people will die. 3 people have been dismissed from some company, and then the whole labor force is going on strike. Yeah. This thing happens, we are going on strike. Look, they should just get to the table and start talking, because at the end of the day, I respect the fact that their views must be considered.
Right.
Whatever they do professionally must be respected. But the point that we also go on strike, the least opportunity, I think we should watch that space, because I think Ghana cannot afford to be losing lives just because a certain bill is not getting the input that it should get. I mean, that's my
I mean, and it's only fair that because I asked him, look, you say you are speaking for the future, you're protecting the future of Ghanaians, but if you're protecting the future of Ghanaians, and while you're trying to get that protection for Ghanaians, you lose Ghanaians, whose future are you protecting?
But now the president has been said that if you want government to hear you, you have to do something drastic. I mentioned this last week that what we're seeing with the strike actions, boycotting of this and that, you have members of parliament who haven't gotten their way, and as a result, they've also abandoned work in the House of Parliament. Is that how we want to operate as a people? If dialogue fails, the next action is strike action, boycotting. I guess people are saying walkout. Is that the only way to grab government's attention? And if government is listening today and watching what is going on, they'll have to step up their game as far as collaboration and communication is concerned. We've seen this time without number. What is the issue? DDEP, no consultation. Bills are coming in, stakeholders not spoken with, food suppliers. We say, are you sure you are really an association? Is this the communication breakdown is very deep, and more bodies, institutions, groups, persons have realized that to get government's attention, you have to strike or boycott or walk out to really get the attention.
I mean, sometimes some of the questions that are asked, like what you just asked, that, okay, are you really an association? We don't recognize you. Must there be questions that people should ask? Because the people are out there. You clearly have been outnumbered. The people are hurting you with their action. And the best answer or the best question that comes into your head to ask is, are you even a recognizable group? Today, here we are, we've been told that the same people who he asked that they are not recognizable and whatever, monies are being paid to them. So when did the Agric minister know that those people are recognizable? See, when you're put into a position of leadership, it's a different ballgame altogether. If you allow your emotions to lead you as a leader, you will always find yourself in trouble.
I find that as a knee-jerk reaction from government, it's almost like, can we call that diversionary tactics? So that instead of getting to the core of the matter, they bring all sorts of by the wayside issues. It clouds the whole thing. But this food suppliers thing, you know, when the spokesperson came, that was a major gripe. Who has sent you? We cloak everything under some kind of political
Now you're paying them.
Yeah.
You're paying them eventually.
So what was the point of all of that?
You could have just given them the money, and then all the embarrassment of people picketing and sleeping
cooking
out there, cooking in the office. Can you imagine if you had some investors coming around? You have expatriates in this country who say, oh, we've heard about Kolebu. Kolebu used to be, blah, blah, blah. Let's go and see Kolebu. Let's go and see. Then they go there and the medical situation is basa. They go to KNU and Konfonachi is basa. They go to Efiang Kwanta, it's the same. They go to Cape Coast Teaching Hospital, same. Tamale. So, because these physicians assistants are all over the country. They are all over the country.
They do a very, very important job.
Because
see, doctors don't usually, we always read in the papers, in the news in general, that doctors usually don't readily accept postings to some of these deprived areas.
That's right.
And we have a lot of these physician assistants who go there to operate in the CHIPS compounds and the small infirmaries and all those small. They do what doctors do to some extent.
Yeah.
So before the health issue becomes critical, he or she will be there to mop up before we get a doctor to come in. So if people like this are just being, whatever they do is being downplayed, it's hurting. But I'm saying that
I have been treated by a physician assistant.
Exactly.
When the doctor came, looked at me, and said, "Yeah, but you're fine. You're okay."
So
just checked it, ticked it, and I was gone.
They do a lot of things that the doctors are not available to do, because we all know how the health situation is in Ghana, where all the professionals are also leaving the country.
That's right.
So if all these ones who are not going to get what they want and they also begin to leave, then I don't know how we are going to survive as a people, because even where doctors and nurses are, we don't have the infrastructure, we don't have equipment, we don't have beds. So the health system now in Ghana is facing a lot of challenges, and we don't want some of these organized noises to be in our ears in the mornings. We need some peace to think about us, because look, if there's no peace in the country, it really affects the health of the people.
That's right.
Because already inflation is knocking everybody's heads up and down. So if these are situations where the Council of State should be kept busy. Because the last time it happened, they came in, they are mopping up. So if anything, on a daily basis, they should be listening and be calling people to the table, because now they are all fighting more or less. I mean, for want of a better word. So we need a neutral body, if you like, to come in and mop up so that they can get to work and save lives.
Yes, but also importantly, government's communication style. I mean, we've talked about this at length. I think government should pay attention.
When you are at your lowest, you don't talk tough.
No.
When you're at your lowest,
no,
you should sound conciliatory.
I think a lot of Ghanaians have actually echoed this sentiment. And gentlemen, you tell me if I'm wrong. There have been times where people have said, we acknowledge that times are really hard, and it's not just for this government. But even before we got to the point where government was conceding that yes, things are bad, we'd had to flog, pretty much metaphorically, flog the issue before going, okay, where we find ourselves.
Right. But even that is problematic.
That, yes.
Because you see, to say that we are in a difficult place is one. To accept that you are part of the reason we are in the difficult place is also another. And to even apologize. Look, if I were to advise government on communication, of course, government won't take advice from me.
Mr. Baita.
Yeah, even though I'm a PR professional, they won't take advice from me. But if they took the advice, you accept, because where we are now is purely crisis management. And in crisis management, the first thing is to be honest about what is happening. Our government has consistently hidden too many things from us. We had to go back and go into corners to find out and bring it before they accept it. Once you do that, your credibility is questionable. You are not trustworthy. People don't think you are candid enough. So you are not being truthful. You are not being factual. You are not accepting your part of the problem, and you are not even showing commitment to fixing the problem. Basics of crisis management.
Yeah.
The government agrees that we are in a crisis, and with all the PR professionals around government, they are not managing the crisis well. Fix the crunches. They shut up. Fix yourself. Then later we come back to say we are fixing it, but it's too late. It was too late. Because when for more than 4 months you held the people, ambush meeting, people going to meeting, they are picked up, arrested, blah, 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 whatever it is, you were then fanning the anger in the people.
That's right.
And that's what you're doing to these physician assistants. That's what you are doing to NAPCO people. That's what you're doing to. So by the time you expect that the people will give you some goodwill, you would have eroded everything. As it is now. Some of the 10 aspirants who want to be flag bearer of the MPP never served in government in the strictest sense of the word. Somebody like Adainimo,
right?
Somebody like Kwabena Ejepong, somebody like Kojopoku. They never served. So their only claim to this race is because they are party people. But today, those who served in government, those who benefited, as they say, from government, those who are part of the mess that was created or has been created, they are all being put on the same wavelength, and they are all being dealt with by the public in the same manner, which is unfair to them. But those are the the consequences that come along with it.
That's right.
So if government is minded, small, to just sometimes not go on an unnecessary banter, but to say, oh, we have heard you. And you see, the man said the minister has been doing a good job for them. The minister takes the thing to cabinet, and the first thing somebody does is, oh, we don't have money for them. We don't actually need them. So when you finish, like he asked, Agenda 111, when you finish, these are the PAs you would need to support the doctors. If, by the grace of God, government finally gets the courage to build, the La General Hospital, you will need it. If you activate the hospital, the military hospital at Afarewa, you will need PAs. You will need them all over the place. Some are retiring, some are traveling and leaving. Those who are staying here and asking you to regularize their right to, that one to be a problem.
So
that hard stance,
yeah. I don't get it. Very defensive. Very defensive.
Alecho, ahantai-crasy, ahumaswa-crasy, enumdwa-crasy. It is not helping anybody.
Yeah, so talking about minim, those who don't know, this is a special report in the Modern Ghana website. I'm just looking at the basic roles of physician assistant.
Right.
These are individuals who are health professionals who practice medicine as members of a team with their supervising physicians. They deliver broad range of medical and surgical services to diverse populations in rural and urban settings. So it's not just even in the rural setting. They come also to the urban centers areas, to support the work of the physicians. As part of their comprehensive responsibilities, they conduct physical examinations, diagnose and treat illnesses, order and interpret tests, counsel on preventive healthcare, assist in surgery, and prescribe medicines. They also promote quality, cost-effective medical care to all members of society. So they do quite a very comprehensive job in terms of helping people to get on with their...
You can simply call them assistant doctors.
Yes.
Pretty much.
But that's what it means. Physician assistant. Physician is a doctor. An assistant is an assistant.
So you safely call them that so that people can appreciate.
Exactly. So they do quite a lot, and this is not a time for us to also push them around and let them go to Bahamas and UK and Canada. We need them. So the conversation must be very, accommodating. Everybody must open up. The times are hard, so this is not a time to
make our lives difficult any further.
Yes, put them in the middle of the conversation and don't just look at rules and regulations all the time.
What would it take if we had 1 page or 2 pages in the bill that features them? How difficult?
They've been fighting for recognition for a long time. This is not the first time we are hearing about peace. Anyway. So the earlier we deal with it, the better.
A few messages for you.
So on and so forth.
And so on and so forth. And then we'll get into the House of Parliament. This is Sunrise Morning Show on 3FM 92.7. It's 10 minutes after 9. My name is Johnny Hughes. I'm here with Helen Apiampafo and William Asedu. When we return from these messages, we're straight back in Parliament and we're asking the question, who is hindering the progress of work in Parliament? Is it a minority or the majority? Stay with us, we'll be right back.
JPS Communications, in partnership with Sunny FM and Sunny TV, with support from Superfarm Network, presents Comic and Comedy, Ghana's maiden stand-up comedy festival.
If you want to know